Hello, 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 my friends. Jill Osborne from the Interstitial Cystitis Network. It is July 30th of 2023, and it's time for another live IC support group meeting. Now, I'm the National IC support group leader. So what is interstitial cystitis? Interstitial cystitis means that you've got pelvic pain. You might have frequency. You might not be able to sleep throughout the night. You might be struggling with urgency, having to run to the restroom very quickly. You might have pain before urination. You might have pain after urination. You might have pain with sex. You might have pain with driving. You might feel like your life is dominated by a bathroom. You might feel like you can't leave your home. You might feel like you might not be able to work. And I am here to tell you that's wrong. That this is treatable, but we have to try to understand underlying causation, because all of these symptoms can be caused not only by the bladder, but they can be caused by lots of other things going on in your pelvis. Like, for example, last week I was working with a lady who had a 10-centimeter fibroid tumor. And her question was, is that going to affect my bladder? And I'm like, hell yeah, that's going to affect your bladder. She's like, how? I said, because there's not a lot of room down there. Think a 10-centimeter fibroid tumor is probably like this big. Can you imagine what that would be doing, pushing against her rectum? She was having trouble having bowel movements, but just pushing against everything. We know, for example, that pelvic congestion syndrome can cause urinary symptoms. That's where you have varicose veins in your pelvis that are filling up with blood, and that's causing all sorts of bad things to happen. We know that very, very tight muscles can cause issues with bladder. Lots of things can cause issues with the bladder and just pelvic pain in general. And so our job here in this meeting is to try to help you, God, how do I want to say this? If you ever talk to me on the phone, because I work with patients all the time, like all day, almost every day, I'm working with patients on the phone. And I was working with a very interesting patient on Friday, and she kept, here I am, like, for me, when I'm working with you, I've got to try to understand cause and effect. My first job is to try to visualize your body. And so I'm going to ask very, very detailed questions about your history and about where your symptoms located and all this sort of stuff. And so I would say, so have you had a pelvic floor assessment? Or so tell me, can you start your urine stream right away? Are you hesitating 5, 10, 15 seconds? Things like that. And she kept going, but this didn't work, and that treatment didn't work, and this didn't work, and that treatment didn't work. And I kept saying, I don't care about that right now. We cannot talk about treatment until we understand your anatomy. And man, it was like finding a needle in a haystack. It's like, okay, come back to me here. Hi, John. How are you, John? Nice to see you. Have you had a pelvic floor assessment? Yes or no? Yes, I did it and it didn't work. Okay. What did they find at your first appointment? Jill, it didn't work. I don't care about that. What did they find? What did they find when they did your pelvic floor examination? And she said, what did she say? I mean, it's always, it didn't work. I tried it. It didn't work. I tried it. It didn't work. It's like I was just trying to get her to focus. She said, well, the muscles were tight. And I'm like, okay, now we know something. So now we know that tight pelvic floor muscles are going to be part of your problem. And you guys, I'm live streaming right now. If I'm looking here, I'm looking at Facebook. If I'm looking over here, I'm looking at YouTube. Okay. And in fact, let me move that window closer to the edge so I don't have to move my face so much. Okay. So my next question to her was, and hi, Sean, how long did you do physical therapy? 2 times. It's like, what? She said, well, it didn't help me. And I went, now, wait a second here. Physical therapy is not going to help you after 2 weeks. We have to focus on trying to repair underlying problems here. So underlying problem here right now is you have very tight muscles. Yes. Do you understand the consequence of tight muscles? No, she didn't. It's like, okay, when you have super, super tight pelvic floor muscles, what's that going to do? That's going to start restricting blood supply. It's going to be very hard for you to have a healthy bladder if you got poor blood supply. She's like, oh. So even if you don't think that the physical therapy helped your urinary symptoms right away, that's okay. What we have to try to do is small, steady steps over time to improve the condition of your muscles, to improve the condition of your bladder. You know that tight muscles are bad. Let's not persist. We've got to work on those. And so, you know, some of you are really challenging for me because you get lost in what you've tried. But the problem is that many of you weren't even diagnosed correctly. Many of you have even never had a pelvic floor assessment, or you were diagnosed 20 or 30 years ago when they didn't know to look for stuff. And many of you are like, well, they gave me the diet, they gave me the Elmeron, that's enough, nothing worked, I'm going to live with this for the rest of my life. And I'm like, have you read anything on IT in the last 10 years? No. Okay, a lot has changed. This is really, really good news for you. A lot has changed for the better. And they're absolutely mind blown to discover all the changes with muscles and nerves and all that sort of stuff. And us actually no longer telling patients this is an incurable bladder disease, but rather a pelvic pain syndrome that's often driven by nerves and muscles rather than the bladder, that the bladder is a victim of something else happening in the pelvis. So, I think one of my very, very important jobs is to try to help you distinguish between cause and effect. The symptoms are the effect. You can chase the symptoms for decades and it will never get better. We have to figure out underlying causation. What's driving those symptoms? Do you have an untreated Hunner's lesion? Do you have a viral infection in your bladder? Do you have a previous injury? So another patient I was working with, and I deliberately don't take notes because I don't want to violate anybody's privacy, and so I hopefully I'm not going to get the stories mixed up. I asked her, I said, where is your pain located? Is it on the inside of your body or is it on the outside of your body? And she's like, down there. And I'm like, not good enough. Is it inside of your body or is it on the outside of your body where you can touch? And it's like, I don't know. And I'm like, well, put your hand down there. You're on the phone. I'm on the phone. There's no violation here. Put your hand where the pain is. And in her case, the pain was by her right hip bone. It's like, where is your hand? Oh, it's about an inch from my right hip bone. And I'm like, now, you do realize that that's not your bladder. And she's like, what? And I'm like, no, honey, that's not your bladder. Your bladder is centered directly above your pubic bone. So in a line going from your belly button straight down, your bladder is there. If you got pain over on the right side, you got pain over on the left side, honey, that is not your bladder. And now what we've got to do is figure out what is at that location that could be causing this pain. And, the odds are it's a bad muscle. It's a bad muscle, some sort of injury, trauma like that. So that was again, that consistently comes up. And so if you call me, I'm going to probe, where is your pain? Because for a lot of you, your pain's on the outside. And it's like, okay, if your pain is on the outside of your skin, that's not your bladder. For a woman, that's estrogen atrophy. It's like, okay, that's a really easy discussion to have. Now, the last case, and what I want to talk to you about briefly, is a woman, the last patient I worked with of the week. And what made her so distinctive to me is that she strained every single time she urinated. She had to push. She had to push to get the urine out, right? Now listen, urination is about relaxation. So it's having a bowel movement. Basically, you sit on the toilet, a muscle relaxes, a sphincter opens, you pee, and you do it in a second. And if you actually have to push really, really hard to empty your urine out, that's a really bad sign. That's a bad sign, number one, that we probably have a muscle problem going on. Because, and the example that I gave her, and maybe some of you can relate to this example, especially patients who have IC and irritable bowel syndrome. So back when my IBS was really, really active, if I ate a salad, I would be in the bathroom within an hour having violent bowel spasms and diarrhea every single time for a decade. Oh my God, I can't begin to tell you how many times that happened to me. And of course, years later, I learned it was actually the lettuce that was causing it. But anyway, there's some moments when your bowel spasms are so violent, they're so cramped that you can't pee. And I would have to walk away from the bathroom for about 15 minutes and come back and just wait for that spasm to release for me to be able to empty my bladder. And in this patient's case, I mean, and I just want to say, it didn't happen often, but it did happen a handful of times with really, really bad IBS, right? I gave her that example. It's like, okay, so if your pelvic floor muscles are super, super tight and spasming, it's going to be very hard for you to relax them to empty your bladder. And one of the symptoms of very, very, very tight muscles is feeling like there's something stuck up there, feeling like there could be a foreign object in your vagina, a foreign object in your bladder, or even feeling like your bladder's full, even when it's empty. And I told her, I said, one of the weird things that the bladder does, whether it's your muscles, your muscles can give you that false sense of fullness, but so can a super, super, super irritated bladder wall. And so if we were to describe, okay, hold on, Karen, we'll be right with you, okay? Hold on. You're raking my point perfectly. I'm going to read your text and message in a minute. Okay, I forgot what I was going to say. Anyway, it can be, I know what I was going to say. So let's think about a typical bladder wall flare. To describe a typical bladder wall flare, you go to bed at 11. Of course, you pee right before you go to bed. You might have even peed a couple of times before you go to bed. You fall asleep. You wake up an hour later. Your bladder feels very, very full. You go to the bathroom. You pee out a quarter cup of urine. You go back to bed. You wake up 30 minutes later. Your bladder feels very, very full. You go to the bathroom. You pee out maybe a teaspoon. You go back to bed. You wake up 15 minutes, 10 minutes, even 5 minutes later. Your bladder's very, very full. You go to the bathroom. Nothing's coming out. And if you strain, you might get a drop. So this is an example of that's a perfect example of a very, very severe bladder wall flare where your bladder's empty, but it feels massively full. We're going to see that really with very bad bladder wall irritation. I wrote a blog on it called An Anatomy of an Utterly Ridiculous IC Flare, where I had 3 strong acids in one day. And I just destroyed my bladder wall that night. And that was the next morning I wrote that article. Anyway, it was fascinating. So again, if you're straining, you have to understand that that's bad and we have to work on that. Number one, We got to make sure your muscles are healthy. You have to understand that every time you strain to empty your bladder or your bowel, you're actually making the muscles worse. And so she was getting to the point where she'd strained so hard for so long, her muscles, I'm sure, were a wreck. And she had never had a pelvic floor assessment. So that's like step number one. Let's get you to pelvic floor. Let's see what's going on with your pelvic floor. And then number two, kind of, oh God, I was working with a young patient who was just given Elmeron. Newly diagnosed, just given Elmeron six months ago. I was shocked, not even told about the eye issue or the bowel issue. So anyway, message number three, straining is bad. We're going to look at tight muscles or we're going to look at very, very bad bladder wall irritation. So Sean here says, you are describing my nightmare every single night. Okay, so Sean, I'm going to say, in my personal experience, when I had those flares, now this was back before, before we knew about muscles. I am pelvic floor driven, but my muscles had been tight for so long, I struggled with ischemia. Okay, my bladder wall was fragile because it didn't have good blood supply. So I was very, very diet sensitive back in the 90s, very diet sensitive. And anytime that type of flare happened, I could always correlate it to something that I had done that day. And so that's when we're going to look at, what are you eating? What are you drinking? Is there something that you think is completely innocuous that is really badly irritating your bladder, like a vitamin, or drinking cranberry juice? Or if you're clinging to that cup of coffee every morning, please God, stop the coffee. If you're getting up that night and you're feeling that every single night, man, you got to clean up your diet like mad. We just got to, and I mean for like 6 months, we got to calm everything down. No irritants here. Speaking of the 90s, so we've been going through a lot of my mom and dad's stuff, and my mother saved pictures of everything. So back in 1993, I was referred to UC San Francisco for my IC. So 1993 was the year that I was really having that, Sean. And my local doctor at Kaiser, my local urologist, didn't know what the hell to do with me because DMSO didn't work. Nothing worked. I couldn't tolerate the antidepressants. So he just sent me down to UCSF, where I was very lucky that I got into the urgent PC ankle stimulation early study. And we found a picture of it. You want to see a picture of me? This is exactly 30 years ago this month. Look at that. Back when I had bangs. And if you look down here, you can see, let me lower it a little bit for Facebook. You can see the pads on my inner ankle. And if you look really closely, you can see a needle sticking out of this ankle. See that? Look at that. Marshall Stoller, that was probably, I think I started my first appointment on my birthday, July 12th, 1993. I still have that dress. That's my favorite dress. Still have it. And and so we have some pictures here. So you can see the needle sticking out this side, right? That's an acupuncture needle. And you can't quite see the needle sticking out on this side. So there's one sticking out on this side too. And there's a little electrode attached to it. Let me see. And then back then, so they had a little clamp attached to it that was attached to a TENS unit. And that's the TENS unit. I don't know. I personally like the long hair rather than the bangs, but it is what it is. And I'm very grateful that neuromodulation at least calmed the nerves down enough that that it broke me out of that very, very painful flare that I'd been in for about a year. But that said, it didn't cure me or heal me at all. What healed me completely was pelvic floor physical therapy. So, Sean, getting back to you, you said you're describing my nightmare every night. So, think about, is there anything going on in the day that would bother you, and tell us what you think it might be. Let's go over to here to YouTube. Kieran says, hi, Jill. I'm in the worst flare I've ever had. Severe burning after urination that triggers lasting pain. Upon exam, she noted pelvic floor tightness as well as a cystocele. Interesting. Your gynecologist recommended pelvic floor physical therapy. There you go. So remember our rule. If you have pain as your bladder fills with urine and it gets better after you pee, that points us to your bladder wall. If you have pain after you're done urinating, that points us to your pelvic floor. And here we have Kieran on YouTube. She's in the worst flare ever, and she's having severe burning after urination that triggers lasting pain. And her gynecologist says it's time for some pelvic floor physical therapy. Yeah, baby. It's going to help, Karen. It's going to help. Now, listen, you have to find a physical therapist trained in pelvic floor work. And there's a great website, pelvicrehab.com, with a big list that you can search by your zip code. At your first appointment, they're going to do an assessment. Their job is to it's a second look at your body and at your pelvis. They don't care about the diagnosis of IC. It's like not even worth talking about. Your job is to walk in and be prepared to describe your symptoms in depth. Pain after urination. Where is the pain? Is there any residual pain? Is the pain on the left? Is it on the right? In the center? Does the pain ever shoot down your leg? Are there any weird, funky symptoms like you feel like you're sitting on a cell phone on vibrate? Do you ever have positional pain? Pain that hurts when you sit down, it hurts. When you stand up, it gets better. And they're going to try to study your body. They're going to start externally. They'll measure your legs, see if we have one leg longer than the other. They should have you walk up and down a hallway. Let's see if you're walking normally, because if you're rolling your ankle in, that's going to tweak your pelvic floor big time. And then they are going to ask to do an internal exam. This is the most important part of the examination. There's nothing funky about it. This is the only way to actually touch these muscles because they're inside your pelvic cavity. And what they're going to do is they're just going to touch muscles in different parts of your pelvis to see if they can trigger any symptoms. A healthy muscle feels like a raw chicken breast. A tight muscle feels like painful beef jerky. So if as they touch these muscles, you go, ow, your job is to go, that's it. What are you touching? Because that's really exciting. That's what I call your hallelujah moment. And hopefully you'll walk out of that first appointment with the names of the muscles that are messed up, with some early physical therapy recommendations, because you can't wing it. You're never going to be able to wing it on your own, and you don't start doing Kegels. That's going to make it worse. You have to go to a physical therapist at least once so that they can figure out which muscle is involved, because each muscle has its own different rehabilitation strategy. So you walk out of that appointment with the name of the muscle, piriformis, obturator, whatever, et cetera, et cetera. And be prepared for the fact that it's going to take time. It's going to take physical therapy, maybe 10 appointments, and you're going to have to do stuff at home, you know. Hey, Donna, again. Donna writes, when I was in the Navy hospital for those 3 days, Jill, they took a lot of tests and they did 2 ultrasounds. They did say that I had a mild thickening of my bladder wall. First time for that diagnosis. I'm having everything you're talking about, so I'm going back down to pelvic floor physical therapy. Down is up and up is down for now. And you're using your TENS again. Okay. Well, girl, you know, I mean, listen, you and I, we have been through the worst trauma you can get through. And the toll that has taken on our bodies and our muscles, our nerves, and our minds and our state of mind is undeniable. Ooh, tears every day. I still cry almost every day. Not as long, I had a good cry yesterday though in my car. Grief is a beast. Sean says you are absolutely correct. I can see why I need to give up my 1 cup of coffee in the morning. I have healed my Hunner's lesions about 10 years ago. I could be back. Pelvic floor physical therapy was amazing. I learned not only what let's say I learned not only was I not working those muscles correctly, but I wasn't breathing correctly. Excellent, Sean. You know what to do. Now I saw some other things. Hello, Nan. Thank you, hon. Nan says thanks so much for all you do. Thank you, Michelle. Nice to see you. Hearts right back to you. And says my significant other has microscopic blood in urine. He's a nervous wreck and having a cystoscope. Is it bad? He also needs a renal ultrasound. Is this anything to worry about? So, Anne, I just wrote a blog on our website last week that talks very, very specifically about microscopic blood versus visible blood. So, microscopic blood is, let's see, here, hold on a sec. Let me just pull it up. Again, do not want to get it wrong here. Hold on one momento. Here it is. There it is. Okay. If your urine in the toilet bowl is pink, red, brown, or tea colored, you have gross hematuria, aka blood that is visible to the naked eye. If the doctor tells you you have microhematuria, this means he saw blood cells under a microscope, and both require a proper workup. Now, gross hematuria is an urgent concern that requires immediate consultation with your medical care providers or a trip to the emergency room if it is severe. And listen, some of you, like, every now and then somebody calls who's like peeing bright red blood. It's like, hon, you need to go to the emergency room right now. This is not normal. Microhematuria is much less concerning, but both can be caused by kidney stones, infections, some medications, prostate disorders, or even cancer. Hematuria can also be an early warning sign, can especially be an early warning sign of cancer if you have known risk factors such as smoking or the use of alcohol, use of tobacco products. Blood in the urine is more common in patients with active Hunner's lesions, especially after a hydrodistension. One study found that up to 30% of IC patients had some degree of hematuria. Of 148 patients, 41% were found to have one episode of hematuria. The causes were benign: simple renal cysts, renal stones, reflex nephropathy, or sponge kidney, and that cystoscopy, cytology, and biopsy did not find cancer in this group of patients, leaving the authors to conclude that the microhematuria was not a cause for concern. The biggest risk factors. So we have brand new guidelines from the American Urology Association on what should happen if a patient has microhematuria. Okay. So patients are a low risk if they're under the age of 50. Women are under the age of 50. Men are under the age of 40 with no history of smoking, with no prior episodes. They may be followed up in 6 months or have a cystoscopy or renal ultrasound just to be cautious. Patients with intermediate risk or middle age, women between the ages of 50 to 59 and men between the ages of 40 and 59 who have smoked from 10 to 30 years should always have a cystoscopy and renal ultrasound. High-risk patients are over the age of 60 with more than 30 years of smoking and a history of blood in their urine. They should have what we call a CT urogram and long-term observation. So I'm really, really glad that your husband's going to get that worked up. A cystoscopy is what I call a looky-loo. A little bit easier for women than it is for men. Basically, what they do is they numb the urethra and stick a scope up there, a cystoscope up there, and just take a look around, see if they see anything bleeding, see if they see anything unusual. And the doctor might want to do a low pressure hydrodistension with cystoscopy as an outpatient procedure so that your husband is not awake during this. That's a reasonable. It would be very reasonable if there was visible blood. I think some doctors would argue maybe not as reasonable with microscopic blood, especially if he was not a smoker. I wouldn't be worried about the cystoscopy by itself at all. The biggest challenge with the cystoscope for a guy is men have long urethras, much longer urethras than women. So it can be a little bit more uncomfortable with the urethra, both as you're doing it and the first couple of times he urinates afterwards. So what you can ask for is to make sure that they're using the smallest cystoscope that they have. That's not going to stretch anything, and lots of lube to get it up there and get out easily. I think the biggest, I've had 3. I would do it. Like literally right now, my doctor said, hey, I'd like to look at your bladder with cystoscope. I go, okay, I wouldn't worry about it. The biggest challenge is just peeing peeing the first or second time. That's really not fun because that urethra is quite tender. And so you kind of have to, my strategy for whenever I had that done, including urethral dilations, is I would drink a big glass of water and I would wait until my bladder was full. And then I would bite my lip and pee and just get through it. I found that stopping and starting urination prolonged that urethral irritation, but generally it went away within a day or two. So tell him he's not alone. This happens all the time. It's perfectly reasonable to request a cystoscope and the renal ultrasound. But microscopic blood in urine does not raise a lot of alarm bells. But it's good to look and follow up, just in case, especially if he was a smoker. Kayleen, girl, how are you doing? How is life for you right now? Cystoscopy is much better under general anesthesia or MAC. Hydrodistension can be very painful. Anne says he's not a smoker. Okay. So, Anne, one of the other things that you could ask the doctor to do is something called a urine cytology test. A urine cytology test is you just pee into a cup, and what they do, oh, that's a squirrel, is they test for cancer markers. And so that's something they could do too that wouldn't require a cystoscope at all. Hold on a sec. Jeannie said, just wanted to let you know that instead of getting up 20 to 25 times a night, I'm now getting up 6 to 8 times a night. So I'm in the right direction. I've had Botox in the bladder and thank God it helped. Congratulations, Jeannie. You are proof that things can get better. I've been there, honey. Hi, Rhonda. Rhonda says, grief is truly a beast. Be kind to yourself. It comes in many different ways. That it does. That it does. I cannot disagree with you. There's something very humbling about grief, because you're just in a car trying to drive the car, but the car goes into grief and out of grief and into grief and out of grief. And it's just the little tiny triggering things that can make it happen. Marlia says, I am the opposite. I have to run to the bathroom or I will pee my pants, especially at night. The pee starts to run down my leg. I don't have pelvic pain. I have, whoops, hold on, darn it. See, the Facebook, the feed is so, it just keeps moving my stuff around. I have hip and back tight muscles by day. I have a raw feeling after I wipe. I've been using estradiol cream 2 to 3 times a week for about a month. Now my muscles are so weak, the pee comes flying out. Oh, Marlia, so you need to be working with a pelvic floor physical therapist about your muscles, or if that's happening, we got to get your muscles better. Your muscles are probably quite weak. So sometimes what happens is that the reason why the muscles become tight is because they're struggling. And that's what they found in me. It was very interesting when I had my first pelvic floor assessment that, so Karen, the physical therapist that I saw, had her finger up on my vagina, and she said, do a Kegel around my finger. And I'm like, okay. So I did it. I could tighten, I could relax. She said, do it again. I could tighten, I took another second to relax. She said, do it again. I could tighten, but it was like 4 or 5 seconds before my muscles actually were able to relax out of that Kegel. And then she said, what this tells me, Jill, is your muscles that are deeper are actually quite weak, and your shallow muscles are compensating for that. And so your levators are very, very tight because they're doing the control that some of the deeper muscles should be doing that they're not doing. And so in cases like that, generally what they do is they try to get you out of tension first, but then they try to embark on strengthening. Now, I will say, listen, I had COVID 2 months ago for the first time. And the coughing was ridiculous. And I started leaking. I'm going to be honest. I mean, honestly, I coughed, I leaked. They call that stress incontinence. And it was shocking to me that I actually had to wear a pad. If I went to the store and I started coughing, I would leak. So I had to start wearing pads, and now I'm not coughing, so I'm not leaking quite so much anymore. But that tells me that I have to keep working on my muscles. And I really feel like I haven't been to a physical therapist in about 2 years now for my pelvic floor. We have a brand new one here who's certified, and I feel like I want to go up and do a couple of appointments just to try to understand what the COVID and the coughing did to my pelvic floor. Yikes. Oh, like, it's always something, right? It's always something. Let's see here. Rhonda says, my biggest issues are starting is due to the hardening of the bladder. I have so much scar tissue due to Hunner's lesions I have. Yeah, that gets very, very tricky. But you're holding 300 cc's, so that's pretty good. Jay says, can varicose veins in the bladder be seen during a cystoscopy? The varicose veins are not in the bladder. The varicose veins are outside of the bladder in the pelvis itself. And so you can see it. You can see the veins in the bladder when they do a cystoscopy, but that's not pelvic congestion syndrome. I don't think you're going to see it there. There was a really cool on my Twitter last night. I follow a whole bunch of medical journals on Twitter because they publish cases, and the cases are so interesting. Let's see. God, there have been a couple of really, really good cases this weekend. God, one of them had like a puppy-shaped kidney stone, and they took the CT scan, and it looked like a puppy. It was crazy. Hi, Paula, if I didn't say hi before. Loretta, hey girl, nice to see you, Loretta. I have pain on bladder filling, but not after emptying. My pelvic floor is severely compromised. My physical therapist told me I have ischemia. Hello, I have chronic neuromuscular disease. Does this make sense that my bladder hurts on filling and it's not, and it is pelvic? Absolutely, honey, absolutely, because that's what ischemia does, hon. Ischemia means that you have very, very, very poor blood supply. So if your bladder is supposed to get 24 or 28 units of blood a day and it's only getting 10, are you going to have a healthy bladder wall? No, you won't. Your bladder wall is going to be compromised because it's getting starved of oxygen and nutrition, and you are going to be diet sensitive, and you are going to have pain on bladder fill. As the muscles get relaxed and blood and circulation improves, the bladder starts to get the nutrition and the oxygenation that it needs, and it will start to heal. But you are diet sensitive, just like I was diet sensitive the first 10 years of mine. Makes total sense. John says, I've had several cystoscopes and always ask for 2 tubes of numbing gel. Makes it, John, thank you so much. Great advice. Got to have a lot of lube for men. I really can't imagine what having a cystoscope is like for a man that's awake. I mean, for me as a woman, my urethra is less than half of your size. It's absolutely a bite your lip moment. Kaylin says, I can't talk about much since my mom is right here. Another successful installation with no bladder spasms on Fridays. Yeah, baby. I'm so torn. I'm so sore and torn up by something else. Of course, my pelvic floor physical therapist is out of the country and it's really hard to get in my OBGYN. I have a referral for a general surgeon since this umbilical hernia is bad. If I hit it, it accidentally tugs on my clitoris and part of my bladder. My OBGYN had to examine it and I almost puked from it being picked at. Yeah, girl, you're going to have to get that fixed. Definitely. There's just no doubt about it. That's just connecting everything. Everything. That's so hard, you know. It's so, hernias are so random. You know, for those of you who don't know what a hernia is, a hernia means that, I mean, normally your body's pretty compartmentalized, right? That things are where they're supposed to be and they're maintained in that position by muscle. But if that muscle is damaged, it can cause a hole, you know, a hole through which bad things come out. Things come out that are not supposed to come out. So intestine can come out that hole. In my dad's case, he had a hiatal hernia. He had all the symptoms of GERD for decades. We thought it was GERD, only to discover in the last week of his life he had a completely healthy stomach and esophagus. What he had was a giant hernia. And so that hernia basically, if this is a bag of your stomach and there's it's being held in place by a sphincter up here, right? Well, there was a hole in the what do you call it? There was a hole that allowed part of the stomach to migrate upwards. And so now part of the stomach was above this and a lot of it was below this. And this was squeezing it and causing a lot of pain. And it's just so important to catch hernias early before they become big, right? If you let it get out of control, it's difficult. I can understand why people don't want to go back to the doctor. I do. But for things like hernias that can progress over time, or pelvic floor tension that can progress over time, it's important to try to jump on it as early as possible. It's like fighting a fire. You know, man, you want to catch the fire when it's in the wastebasket. You don't want to catch the fire when your house is being consumed. And so if we can nip that pain early, and nip that hernia when it's very small, or that bladder irritation when it's mild rather than severe, we can save a lot of suffering. Eddie says, having long COVID, so I was taking nattokinase to treat it. I took it for 2 weeks, knew it was flaring me up, but I ignored it. I haven't taken it now for 2 weeks, and I'm still brutally flared up. Let me look it up, hon. I am not familiar with nattokinase. Let's see what WebMD has to say about it. It's an enzyme that comes from a Japanese food called natto, made from boiled soybeans. It may thin the blood and help break up blood clots. Okay, that makes total sense with long COVID. And so this might protect against heart disease and conditions caused by blood clots such as stroke and heart attack. People take nattokinase for cardiovascular disease, including heart disease, high blood pressure, high cholesterol, and stroke. But there's no good evidence to support these uses. Now, obviously, with COVID, COVID is a virus that attacks blood vessels. COVID is absolutely associated with a lot of blood clots, a lot of strokes, amputations because of blood clots. So using it makes total sense to me. So let's look at the side effects. They don't even have any side effects listed. Precautions. Been eaten in Japan for hundreds of years. It can act like a blood thinner. It might make bleeding disorders worse. Not saying it's Eddie says it's a warning for anyone with IC. Stay away from nattokinase. I haven't been this flared up in 20 years. Feel like I got my IC under control years ago. Now I'm back in my 20s with get terrible IC. You think, honey? Do you think it was the soy? I got nothing for you, hon. I'm just not seeing any urinary issues with this at all. Looks interesting though. Wow. Dissolved my grandmother's blood clots in the lung. She had COVID pneumonia. As a result, she had blood. It was very scary. They tried to prescribe her Eliquis, but after research, somebody found nattokinase. Blood clots are gone within 2 months. Huh, interesting. Lots of COVID stories here. Interesting. Very, very interesting. All right. Well, thank you for sharing that. You think it was the soy? I thought it would be flared up for a while and have it go away, but it won't. It's very strange. Well, understand too, Eddie, that it may be that you're a little bit more vulnerable right now just because of aging. Maybe we've got some estrogen atrophy going on as well. Kayleen said her hernia is 3 inches long, transverse, drooping over my belly button. It's in my chart as a tiny umbilical hernia. 3 inches long is not a tiny hernia. It bugs a lot of my pelvic floor. That's crazy. A tiny hernia would be the size of a peanut or a pea. Hi, Gay. Nice to see you, hun. Very, very, very nice to see you. Hope you're doing well. I will tell you that here is the cover of our new magazine. Don't read the letters. My typesetter had a family emergency and had to leave for a week. So we couldn't finish it up. We'll be finishing it up on Friday, next Friday. Family things happen. We always have a kind of a meditation page. This is our meditation page for this year. I mean, for this issue. We rise, we rest, we heal. And we've got articles. This is almost a total double issue on the inflammatory bowel disease associated with Elmeron. The Lactobacillus iners, IC research from AUA about could dysbiosis in the bladder be playing a role in IC? Yes, I think it is for some of us. We have an interview with an expert. Ooh. Our article on microhematuria. Research from ESSEC, our European IC research community. Lots of new studies from Europe. We have an article on the long-term effects of toxic exposures in the bladder for men and women in the military, and how that has been linked now to IC symptoms. Of course, I worked with the U.S. Army for about 10 years doing IC research. Back to school strategies. Completely redid our back to school strategies for children and teens with IC and pelvic pain, because school will be starting again in 2 weeks here in California. And for that child who's got urinary frequency urgency, they face tremendous challenges at school. Tremendous. Getting a teacher to actually believe that that a child may need to use a restroom, not just at recess, but every hour, is very, very challenging. We have to involve the school nurse. We've got to involve the principal. We've got to make it a safe place for that child, that they're not ashamed that they have to use the restroom. There's got to be a very easy signal that the child can do that will not bring attention to the child, and yet allow that teacher to say, yes, honey, you can go use the restroom, or you can go. And of course, for junior high and high school, they only have 45 to 50-minute classes, although sometimes there's a 2-hour class 2 days a week. The problem is that they have really started locking bathrooms down. And sometimes teachers will punish that child for having to get up in the middle of class and use the restroom, and will give them detention. None of this is okay. None of this is okay. Now, remember, my IC symptoms started in 7th grade. I couldn't sit through class. Teachers got pissed off, called my mom, and that began this whole bag for me back in 7th grade. And, you know, yes, schools are more violent now. Yes, security, especially in high school, is incredibly important. And we know that bad things sometimes happen in bathrooms at schools. And it's just, we can't even, that's a whole nother discussion of what's happening in schools right now. It's not like when I was in school. So it may be that teenager may have to go use the bathroom in the office or at the nurse's station. And then, of course, we have to have very clear instructions for substitute teachers, so that substitute teachers are aware that this is not a child that's acting out. This is not a child that wants attention. This is a child who has a legitimate medical need. And there have been lawsuits. There was a mother who sued a school district in San Diego because they would not let her first grader use the bathroom when he needed to, and he kept coming home with wet pants, and finally discovered that he was being mistreated by his teacher. And then, as I was thinking about the challenges that children face in schools, I was like, well, wait a second. What about my dear friend who's a teacher? What are the challenges that teachers with IC face? And so we did our first story on this. And I had a long talk with her. Rule number 1 for teachers who have IC. And remember, we did a professional survey. What are the most common professions associated with IC? Number 1 was teaching. Number 2 was nursing. So why would teachers be more prone to this? Well, because they can't leave the restroom. Their diets are probably not the best. They're the ones who are probably going to be drinking coffee and soda, and yet they cannot leave their children to go use the restroom. If they're lucky enough to have an aide, maybe. If they don't have an aide, they got to hold it. So, and then the other thing she said to me that really, really surprised me is that if your classroom is on the far side of the school from where the teacher's bathroom is, you can't even get to the bathroom to use the bathroom, much less have a bowel movement in a typical break, right? And so what she had to do is she was able to get her classroom changed to a classroom that was much closer to the teacher's bathroom. She pointed out that a big challenge for elementary school teachers is yard duty, that they're expected to leave the classroom and go immediately out onto the playground to supervise the kids, and they don't have time to use the restroom. That's a bit of an issue. Doctor's appointments are very hard for teachers with IC. If the doctor's appointment is in the morning, they have to hire a substitute teacher for half of the day, not for an hour. So it's 4 hours. And so the best strategy is to try to have your prep period as the last hour of the day, so that if you need to leave in that last hour to go to an appointment, they might not have to hire a substitute, but sometimes some school districts will anyway, just to screw you. Field trips can be challenging. Food can be challenging. And anyway, so we've got a great article on that. One thing, my mom was a retired elementary school teacher, and honestly, her school was a couple blocks from my high school. And so every day, except for when I was playing tennis, every day after school, I actually walked over to her school, and I volunteered at the school. And I loved every minute of it. It was so fun to hang out with those kids and go on field trips with them and stuff like that. I just didn't. And I took the teacher's exam and I passed it. Actually, I had a perfect score, which is crazy. First time I ever had a perfect score on anything. But I decided not to go into teaching because of my restroom access needs. So I'm teaching now. What else do we have? We have articles on genitourinary syndrome of menopause, new warnings. Oh, this is, guys, this is so interesting. We all know in the IC world that artificial sugar is bad. I mean, we know that. We know that artificial sugar is very irritating to the bladder. And we also, last 2 months ago, the World Health Organization announced that they were going to say that they actually last spring, they suggested that nobody use any artificial sugars, that they are just a risk to human health. They have a cancer risk, et cetera, et cetera. So what was interesting with the World Health Organization warning is they left out sugar alcohols. And I've had terrible reactions to sugar alcohol, terrible diarrhea. Let me tell you, bathroom for 3 days after I ate a balance bar made with sugar alcohol. So much so I complained to the company, and they gave me like $20 worth of coupons, which I never used. I reamed them because they didn't have warning that they were using erythritol, a sugar alcohol, in it. So anyway, this is one of the parts of the job I love. I love being a consumer advocate. And so this came out, and I thought, well, wait a second. Why'd they leave out the sugar alcohols? Because in February of 2023, the Cleveland Clinic studied 4,000 patients in the USA and Europe, found that those with higher blood erythritol levels were at an elevated risk of heart attack, stroke, and death. Why? Because sugar alcohols are associated with the formulation of blood clots. Who knew? This is new as of, last spring. So I think now I look at everything, and I think it's very, very important that we walk away from all these artificial sugars whenever possible. Yes, we are all addicted to sweet flavors, and we got to work on that. And in fact, what I have here, this is a combination of black cherry and lime mineral water with no sugar in it, no acid in it. It's just flavored, so there's nothing in it that's irritating. Tastes good. Articles on exercising, swimming. Can you swim when you have IC? Yes, you can swim when you have IC. Swimming is a great exercise when you have IC because it keeps your hips level. But there are a couple of things we've got to understand about swimming. Number one, if you've got estrogen atrophy and your skin is super dry, that chlorine can be irritating. And so some swimmers will put a layer of Vaseline or a layer of D-Magic on their tender bits down there, which will repel the pool water. And then just making sure that once you're done swimming, go change out of your swimsuit and take a shower and wash all the chlorine off your skin. Don't sit in a wet bathing suit for a long period of time if you have dry, sensitive skin. With respect to pool chemicals, we certainly know that chlorine can cause pretty significant injury. We have that data from the Center for Disease Control. I, too, was badly injured and burned by a chlorine misapplication in my local pool back when I was training for a triathlon. Burned my bladder and my kidneys terribly. So you want to make sure that you swim in a pool that they're being conscientious with the chemicals. You can actually bring little test kits with you. I would be a little bit more careful with a hotel pool. And the one hard no is a community hot tub. I would absolutely stay out of a community hot tub because you don't know if they're being maintained and there's just too much bacteria exposure in that hot tub. Eddie says, I'm 42 years old, a male. Is it estrogen atrophy? Eddie, I'm going to say right now, my guess for you is that it has nothing to do with estrogen. It has to do with very poor blood supply from tight muscles. Because the vast majority, 90 to 95% of the men that we work with, there is a previous pelvic trauma injury that has left those muscles very tight. You're now in a state of ischemia. Your bladder wall is just not healthy because it doesn't have good blood supply. So Eddie, go back in time. Can you remember any pelvic traumas? Or were you a football player, bike rider, motorcycle rider, horseback rider, any big falls, anything at all like that? We really now, for the great majority of men, we're always going to look first at muscles and your history for trauma. No doubt about it. I was working with a guy a couple weeks ago. He's like, no trauma, no trauma, no trauma. Or like 30 minutes. No trauma. And he goes, oh, wait, yes, no. I actually did have a bad fall on my tailbone. There's our trauma. Okay. Let's see here. That's a good article this JC did on swimming. So anyway, so this is going to be a week late, but family emergencies happen, as we all know. Let's see. Rhonda says, children and especially teens struggling in school are the most difficult. Even with provider notes, they still get punished. Absolutely. Katie says, parents of children with IC should advocate for a 504 plan. This will ensure that school personnel will all make accommodations. What is a 504 plan, hon? I've never heard of that before. Maybe that's in your state. Can you tell us a little bit more about that? Rhonda says, my mom went through the struggle. I also went through the same struggles with my daughter. So many times I went off on teachers and office standing with those teachers for making my daughter stay after school for as punishment. She was diagnosed with overactive bladder in school. IC wasn't a thing for teens in the early to mid 2000s. She said, I finally took my daughter out and let her finish on public online. She missed her friends, but she wasn't bullied any longer by the school system. My daughter also had less flares, better grades, no longer depressed, less true UTI. And yes, she has finally been diagnosed with IC. So Rhonda, what subtype? What subtype do you think she has? Marlia says, ever since I was told I have IC, I can't stand anything around my waist or underwear on my pelvis. And have seen many people in my support group complain that any tight clothing and jeans causes them to flare. I hate to wear underwear that makes me feel raw. So Marlia, that's vulvodynia, hun. Very common for patients with a very sensitive skin on their vulva, vulvodynia or estrogen atrophy. Many cannot wear underwear. And then what happens is their nerve cell on their skin gets so incredibly sensitive that even touching a pubic hair triggers intense pain. That's called allodynia. And for moments like that, doctors can give you a lidocaine gel that you can put on your skin down there that will help to silence those nerves and calm them down over time. So anytime we have sensitivity, especially to underwear, we're going to look at the concept of allodynia. One of the other things that happens is what we call the icy belly. And you've probably noticed it where you have a flare and all of a sudden you look down at your stomach and it's like bigger. Like, where'd that come from? And that's what we call the icy belly. And that is actually inflammation. And it does go away, kind of comes and goes and comes and goes. It's one of the interesting things that happens. And I don't know if we can actually correlate that with a subtype. It's just very common. And so that's why doing like everything that I wear, like what I'm wearing today is a cotton knit. I don't like anything that's not stretchy. Katie says, it is a plan that ensures that students with disabilities will be accommodated and supported. They can be created for students with learning disabilities and medical conditions. Oh, good. Let me. Cool. Thank you. I will leave that window open so that I can look at it. And then maybe they've got a great video. I can add this video to the article. Excellent. Thank you, honey. Rhonda says 504s don't always work, sadly. Yeah. Danielle says, what you just explained sounds like me too. I cannot stand underwear and I burn even though I take estrogen down there every day. So one of the things that they can do, Danielle, is they can combine the estrogen with the lidocaine in a jelly. So it's kind of the consistent, it's like in a Vaseline jelly. And that worked really, really well for me. I still have a tub of it in my bedroom. I always know if I'm walking, if I get that weird, like, that sensation that you get if pubic hair gets stuck in a zipper, like a little pulling sensation. I know if I have that sensation, that means that something is going awry, either with my skin or my muscle squeezing nerves. And so using that topical estrogen with the lidocaine just calms immediately those superficial nerves in your skin. Very, very effective. There are a lot of different compounded formulas that have been used for vulvodynia. Another one that's used is called Amibac. It's an amitriptyline baclofen combination. Or they might do, so the amitriptyline is the antidepressant that calms nerves down. The baclofen is a muscle relaxant. So an Amibac cream is common. Or they might do a ketamine amitriptyline baclofen combination also. And it's okay to ask for these compounded creams if you're suffering with that extreme sensitivity down there. A couple, like this was before COVID, I had something weird happen where I felt like I was being poked by pins down there. And it was in the pubic hairline. It wasn't in my labia. It was kind of on the outer labia along the hairline. And it started in the front. And it was like poke here, poke here, poke here, poke here. And over a period of a week, it started the front, moved all the way to the back. And then finally it went inwards into the labia. And it was very, very uncomfortable because it was like pinprick, 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 left side, right side, front, back. And so I went to urgent care and they thought it was a yeast infection because I was bright red down there, just bright. They're like, wow, you are red. It's like, well, I feel red. It feels awful. So they gave me diflucan and yeast meds, didn't touch it. So a week later, I go to my regular gynecologist. She goes, looks like eczema to me. She put me on steroids for 6 weeks. Got worse rather than better, really bad. And I was just kind of getting to that, not quite panicking, but getting really angry about it. And so I asked for a referral to the pelvic pain specialist at Kaiser, down in San Francisco. She looked at my case. She called me up. She goes, Jill, don't you know what this is? And I'm like, no. She goes, honey, your muscles are tight and they're squeezing the nerve. And I was like really shocked because I didn't really realize the tight pelvic floor muscles would cause that pin pricking sensation on, on the outer labia. I was really, really shocked by that. And so she sent me back to physical therapy. The physical therapist went, yep, you're tight as a drum. And she prescribed the estrogen lidocaine jelly and worked like a charm. I know 3 weeks later, it was all gone and I was better again. So just another lesson of how tight muscles can tweak nerves. Hold on. Katie says, Rhonda, I'm so sorry to hear that. My school takes them very seriously. I believe that a 504 is a legally binding document. So if it isn't followed, there could be legal repercussions for the school. Yeah, it all depends upon the quality of the principal, unfortunately. Danielle says, I have been on many times when I take my methadone at 7 o'clock at night. It's the only time the muscles calm down there enough where I can walk around without pain. So Danielle, let me scroll back here. And guys, I'm very itchy today. Allergies peaked this morning. Hold on a sec. Like, what the hell is blooming right now? Because I woke up all stuffed up. My hay fever is not happy today, and I'm just kind of itchy, cranky. Is it pollen.com? Here it is. Let's see what it is. It is. Yeah, here it is. Medium. So what the heck is it right now? That's bugging me. Not saying what it is. I think it's ragweed. Well, anyway. Sorry. I get distracted by my itchiness and my nose and stuff trying to do these. So Danielle, let's see. So Danielle, what's going on with your pelvic floor, hun? Have you had a pelvic floor assessment and are your muscles tight? Marlia says, so I see lidocaine over the counter, 4 to 5%, often found in the hemorrhoid section. Just lidocaine is the only ingredient. Is that okay? Yeah. Called Anacream, Anecream. I've used it. Rhonda says, my daughter is more subtype 3. I believe she's subtype 1 also, but she keeps backing out of the hydrodissension cystoscopy. She has symptoms of Hunner. I keep telling her that she needs it to be done. She needs the biopsy and the full look at her bladder. If Hunners are present, they would be treated. I think she is too scared. She's seen me suffer for so long. I can't even talk her into doing physical therapy. Hi, Peggy. Oh, honey. Why do you think she's Hunner's? What's her pain level? I mean, if she's crying in pain and down to eating 4 to 5 foods, definitely Hunner's. But if she's not crying in pain every day and she's just got more frequency urgency, then we want to look at muscle. Depending upon her age too, generally for kids, if this begins in childhood and teenage years and even 20s, we're really going to be looking for injury, past injury. Pelvic floor injury is the most dominant cause. What did I miss here? Hi, Nick. I know you can't talk her into doing PT now. Sometimes they just won't go there until the symptoms are really interfering with their life. And then once it interferes with their life, then they're willing to do it. It's hard. Danielle says, you and I talked a couple months ago on the phone. I'm the one that had the surgery with a difficult diagnosis, and they told me I had lichen sclerosis. Then they said it wasn't that, it was yeast infections. Then they told me I had pelvic floor dysfunction, but nobody ever told me what to do about it. I lost 3 doctors in a year. Now I have no doctor, so I'm ordering an ozone machine. Why would you do that? Honey, you need to be at physical therapy right now. An ozone machine is not going to fix tight muscles. And if they told you you have pelvic floor dysfunction, you have the diagnosis. You have to do the muscle work. She said, no assessment yet. They just told me it was dysfunctional. To me, it feels raw and dysfunctional. If anything, I think my muscles are too tight, but I don't know how to relax them. It hurts to walk or stand. Why haven't you gone to physical therapy? What are you waiting for? You have to go see a physical therapist, especially if it hurts to walk or stand. And it's the physical therapist has to figure out which muscle is tight to tell you how to relax them properly. Of course, you don't know how to relax them. That's a physical therapist's job to tell you how to do that. Ravonda said, all bases have irritated me. Interested to know what preservative-free base you have mentioned for the bioidentical compounding. It's a paraben-free. Ravonda, paraben-free. Rhonda says, my daughter suffers in pain daily. She's now 29. She's lost so much weight. She used to be 200 pounds. She's down to about 150, and she's a tall lady like I am, 5'9". Well, 150 is actually, that's a good weight for somebody 5'9". I'm 5'9". My ideal weight's like 142. But that said, we can't discount the fact that she's in pain, and it would be nice to know why she's in pain. And it would be nice to fix that. It could be something as simple as her diet and drinking too much diet soda or coffee. Or it could be a previous injury, or if she's had a baby or anything at all like that, or if she ever broke her tailbone, or if she has scoliosis, or if she has one leg longer than the other. The sooner we catch it, the sooner she can get back to having a normal life. And so having that pelvic floor assessment is just kind of a no-brainer. And if you, Rhonda, if you want me to talk to her, I'd be happy to talk to her. Danielle says, they want me to get some type of referral, and when I call my insurance company, I get the runaround. It's like being handed the death sentence. So see if your primary care will give you the referral, hun, or your gynecologist. See if your gynecologist will give you the referral. Just do that instead. But this is like urgent. And if they won't give you the referral, go pay for it out of pocket. First appointment, if you can afford it, might be $150. It's going to be really important that you get in there and get checked. One of my good friends, was so interesting. One of my good friends, who had severe IC, her doctors kept telling her she had a normal pelvic floor. She's like, I don't think it is normal because she had the symptoms. So she went to a physical therapist anyway, and the physical therapist found tons of trigger points in her pelvic floor and her inner thigh. And the physical therapist was stunned that anybody told her she didn't have pelvic floor. She had terrible pelvic floor. So, sometimes we have to be the force of change and say, well, I don't know if I really believe you. I think I'd like to go pay for that out of pocket. Rhonda says for her daughter, we do know she has a tailbone injury. We also know after that tailbone injury, she discovered one leg is a tiny bit longer than the other. It's a work injury. She has a lot of the same symptoms that I had with Hunner's lesion. Well, I would back off on pushing her about the Hunner's lesions because that's probably scaring her. Let's start with the easy stuff first. Let's get the pelvic floor checked. And if her pelvic floor comes back completely normal, then I think the next step would be maybe looking in the bladder. But then that's what the AUA says too. The AUA says if the doctor finds tight muscles, you send them immediately to physical therapy. We only do the hydrodistension when the diagnosis is in doubt. So maybe back off on pushing about the Hunner's lesions and talking about the Hunner's lesions, because it might not be Hunner's lesions at all. That tailbone injury is pivotal. Peggy says, my appointment with my physical therapist is August 16th. I'm excited and scared. I want this to work so bad. I wish you the best, honey. Carry hope in your heart. Rhonda says she suffered with OAB since an early age. I believe she inherited it from me. Honey, the only thing that she could inherit, there's two things she could inherit from you. Very, very sensitive nerves. Or she could have inherited, maybe your diet is such that she's inherited a funky biome. You know, that's possible. Danielle says, can pelvic floor truly be changed for the better? Living proof. You're looking at living proof. Listen, I had symptoms from 7th grade for decades. I did all the bladder treatments. Then my bladder got really bad in my early 30s. I am completely symptom-free now because we found my underlying cause. And I have a perfectly healthy bladder. We did a hydrodistension. We've looked at my bladder. I have a baby bladder. It looks perfect. My problem has 100% pelvic floor and nerve sensitivity. And once we got the nerves calmed and once we got the muscles healthy, all of my symptoms went away. My IBS went away, my vulvodynia went away, and my bladder symptoms went away. Danielle says, I'm hurting 4 years and counting because the pain has become so intense that I'm dark and there's no way I can continue going like this. Honey, you haven't done the single most effective treatment we have. And this is why, I mean, understand Danielle, listen, if you go back and you look at some of those early papers about IC that were published, all the urologists back in the 30s, 40s, 50s, 60s, 70s, dark ages, right? They all describe muscles so tight, they're like tight piano strings. They all describe them. But of course, urologists were like, yeah, but it's a bladder thing. Urologists didn't work with muscles. Urologists worked with the bladder. Urologists were operating on the assumption this was a bladder disease, even though they had concrete proof with their own fingers that there was a muscle problem. It never dawned on them to treat the muscles. And it wasn't until 2008 or 2011 that we started having a physical therapist come who had the audacity to come to urology events and challenge the doctors and say, hey, you're describing tight muscles. Are you treating them? I've treated them and patients are getting better. And they blew her off. Her name was Rada Katerinos. They blew her off for a couple of years. But she was able to convince the federal government to do a large study. And when the data from that study was released, the data was shockingly good. That pelvic floor physical therapy outperformed bladder treatments 2 or 3 to 1 by far. And when that data came out, the entire IC world was put on its head because up to that point, everybody's going bladder disease, bladder disease, bladder disease. And then, oh, wait, physical therapy helps? Oh, maybe this is a muscle problem for some patients. And now we know that it's a muscle problem for most patients. 85% of IC patients have an underlying muscle disorder. So everything has changed. Everything has changed. So, so I want you to carry hope in your heart. Physical therapy is changing the lives of thousands of patients. We have now thousands of physical therapists who are trained in pelvic floor work. And as we had other patients who were sharing here in this chat today, and myself, pelvic floor physical therapy is absolutely life-changing. Now, so, Danielle, call me. I know we had to have talked about this when we talked before, because I talk about it to everybody. So stop waiting, make it happen. Go to pelvicrehab.com, search for a physical therapist near you, and call them and say, can I self-refer? If you cannot, like in California, you can self-refer for up to 10 visits. If you can't self-refer, call your OBGYN, say, listen, I need the referral. Can you please write one for me? I want to go get this checked. I'm suffering. You're suffering. We have to find why. And the odds are it's your muscles that are the dominant problem here. Rhonda says, I don't have to tell her. She knows from watching me since she was so little. I just want her to go to a specialist where she can get out of pain. She has 4 children, range from 12 years old down to 3 years old. So Rhonda, we know her pelvic floor is toast after having 4 children. And so having, for that point alone, she's had 4 children. She doesn't have the normal muscle tone anymore. The odds are her muscles were compromised in some way by carrying those babies and delivering those babies, and or if she had a C-section. And so it just makes sense to go, well, let's make sure the muscles didn't get hurt through childbirth, because muscles respond beautifully to muscle therapy. So let's get the muscles checked. And as Rhonda says, yes, pelvic floor therapy helps. Even if it doesn't take someone in remission, it will still help give people tools that help them. It did me. It will help control pain when the pain is being exacerbated by tight muscles, or the pain is being caused by tight muscles. Eddie says, nothing like that. My dad always got bad hernias. Could this at all have been contributed to my pelvic floor problems? Is it hereditary? I was told I had a tight pelvic floor. Eddie! Oh, Eddie. If you inherited scoliosis, if you inherited a bad hip, if you inherited one leg longer than the other, or if you suffered any injury, that could explain why. So, dude, you are yet reinforcing my opinion that the vast majority of men have tight pelvic floor. You were told you have a tight pelvic floor. So what are you going to do about it? Are you doing physical therapy? You have to do physical therapy. We have to get that tissue out of ischemia so it has good blood supply. Danielle says, I have a C-section and my son was 9 pounds, 2 ounces, and they told me the scar tissue is what cut into my bladder. Then after the surgery, my muscles got far worse. My grandmother had 7 children, all birthed naturally, 9-pound babies, and she has no pelvic floor problem. Lucky at 92. She's incredibly lucky. Probably because back then they were not doing episiotomy. They were not trying to get in there and cut so much to try to get babies out. They were probably letting it proceed naturally. But I'm sorry about that scar tissue. That's a really bad. If the C-section ended up cutting your bladder, that's very, very unfortunate. And I'm so sorry that happened to you. Peggy said, is there a place to read about patients who have gone through physical therapy and get their life back? Well, we have a lot of patient stories on our website, but everybody's changing. People aren't coming to websites as much. Websites are kind of dinosaurs now, which is really sad because it's a really great place to get a lot of info. I think some of the best testimonials about pelvic floor physical therapy are on a physical therapy website, pelvicpainrehab.com. Their blogs are exceptional. If you could subscribe to the blog at pelvicpainrehab.com, it will serve you well. They are by far the best educators on pelvic floor tension and pelvic floor disorders and all of the other medical conditions that are associated with that. Most importantly, how to treat it. So pelvic pain, let me make sure I got that right. Pelvic pain rehab. Yeah, pelvicpainrehab.com. This is the website for the Pelvic Health and Rehabilitation Center. And they have offices here in California and some offices back east. And they just opened up a new location. These guys are fabulous. The founder, one of the founders, is a former president of the International Pelvic Pain Society. So let's see. So they have offices in Northern California, Southern California, Lexington, Massachusetts, Merrimack, New Hampshire, and they're now opening a new office in Columbus, Ohio. So this is a great resource for anybody in Ohio and New Hampshire and Massachusetts and California. You're welcome, hon. You're very, 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 very welcome. You know, I gotta tell you, I'm very sore. My back is very sore today for two reasons. I did a lot of lifting. Yeah, my lower back is like not happy with me because we are doing a big estate sale of my dad's. Anybody know any ham radio operators? I got about 2 tons of radios that we're going to try to sell in 2 weeks. The best of the best that were worth thousands of dollars a couple of years ago that are now worth hundreds because the ham radio hobby is dying. So sad. So I've got all this radio equipment that we're going to try to sell. And then for the first time in 20 years, I went and played tennis. And it was cool. It was fun. I smiled the whole time. But I tried serving and I totally tweaked my back. And I don't have the right shoes. So anyway, that's one of the things I want to do is I want to try to play tennis again a little bit. All right, you guys, you got to hit me with questions. Hit me with questions. If I missed a question, don't take it personally. Just ask it again because sometimes it scrolls by me and I can't see it, especially here on Facebook. Ravonda said, let's see, have I heard of solar pelvic therapy? It's something new. My IC specialist is recommending. So yes, let me look it up real quick because I don't want to confuse it with something else. I believe it. Dr. Chip Buttrick, who's one of the top IC doctors in the Midwest. I think he's on the team for SOLA. Let me take a look. So SOLA physical therapy is for people who have tight, tender pelvic floor muscles, including pain with sex, pain with sitting, pain with standing, pain with exercise, pain with urination, pain with bowel movements, and vulvar pain. And it is using light energy to stimulate mitochondria, which are mitochondria are just kind of energy centers, energy power centers within the cells. And they say that it initiates a powerful pain-reducing chain reaction that helps your body heal from the inside out. There are 5,000 publications and more than 300 clinical trials. And they use it in the doctor's office. They have a wand that they insert internally directly to the pelvic floor. It is a soothing warmth that can be felt during treatment. Now, I want to, hold on. So this is different from, well, is it? this is not vaginal laser therapy that they claim will rejuvenate the walls of the vagina. And there are a lot of warnings about vaginal laser therapy with patients ending up being burned by the laser internally. This is very, very different from that. So do I have any direct IC patients off the top of my head that have done it? No. But it's interesting. The data looks pretty good. It looks to be non-invasive. It doesn't involve surgery other than inserting a wand internally. And I know some of the top IC doctors are now doing it. So I think it's interesting, and I would explore it. They say it relaxes tender spastic pelvic muscles, improves circulation to inflamed muscles. Hello, that's the goal here. And reduces pelvic muscle pain. Some patients feel significant relief after 3 to 6 sessions. Patient data shows 4.5 treatments before the patient notices benefits, and relief is expected to increase over time. Are there risks? The risks are low. Some patients may feel a temporary discomfort or tender vaginal muscles after the procedure, but this resolves. You should not be pregnant when you do it. I think it looks good. For super tight muscles, it looks promising. With that said, I'm just going to say that muscles respond really well to hands-on work, because sometimes your muscle is locked into tension. And so does it make any sense to put a device here doing energy to try to get this muscle to relax? Or maybe shouldn't we just massage it down and get it to relax just with some easy hands-on techniques and movement? So I think the hands-on physical therapy is very, very important. Danielle said, is there any way I can buy pelvic floor equipment? No, honey. You can buy a wand, but you'll never figure it out on your own. We have wands in the IC Network shop, but you have to go to a physical therapist. Get your butt into the car and go to the physical therapist. Listen, I had to drive to San Francisco, 80 miles in agony once a week for 10 weeks while I was doing my therapy. I told them I couldn't do it. I got there. You can get there. You're strong. You made it this far. You can always ask for some pain care and just say, listen, I know I need to do it, but sitting hurts really badly. Can I have, maybe they can give you a muscle relaxant that like baclofen, which is a non-sedating muscle relaxant. You can drive with baclofen, and that would help get your skeletal muscles out of tension while you're in that car getting yourself to physical therapy. But that hands-on physical therapy is really critical here. You can't walk away from that, Danielle. It's so important. Marlia says, I'm dying for a cup of coffee. I haven't had any in 3 years. Have you heard of Ticino hazelnut? I know you like dandelion, which I need to try, but someone gave me Ticino, but I'm so afraid to do it. Ticino is not going to flare you. The question is, it's just very bitter. I mean, the IC Network sold Ticino for years. I just couldn't stand it. I mean, for me, you'd have to put a lot of sugar and a lot of cream in it to get Ticino down. Dandyblend's a lot easier to get down, and frankly, it's milder and it has a much better flavor, in my opinion. So if you're looking for low acid coffees, you can get them in the IC Network shop. This is kind of a sampling of some of the things that we have. We have all the supplements that are often used by IC patients, including our fabulous low acid multivitamin, Bladder Smart. And we've got Bladder Rest. If you haven't seen Bladder Rest before, that's kind of a nice starter formula. Chondroitin-based formula that might help calm the bladder down. bladder builder, Cystomend, a new product called Endometrio that is designed to calm some of the inflammation associated with endometriosis, getting pretty good reviews. Uroprostis for men, PEA, Peora, to try to help calm nerves down. A lot of people ask me, what do I take? Because my bladder wall is healthy, I don't need to take anything for my bladder wall. I have to take things for my nerves. Like my nervous system is tweaked today. I am tweaked today. My skin is not happy today. And I think it's because of my allergies. Everything just got tweaked. Plus I worked really hard yesterday and I did a lot of stuff yesterday. I pushed myself a little bit. Melody says, I've got a Foley catheter that was put in my bladder last night after going to the ER, not being able to void all day. They gave me a bag of fluids and put me on the bedside commode. I had to strain and strain to pee. Then afterwards, they did a bladder scan, and I still had 600 cc's in your urine, plus you kept flowing. So they left the Foley in and sent me home to follow up with my urologist tomorrow. Well, how do you feel, Melody? Is it better? I mean, having the Foley is annoying as hell. But how does your bladder, I mean, your urethra is not happy, but how does your bladder feel right now? Marlia says, but Dandy Blend doesn't have any acid, honey. It has no acid in it. Dandy Blend is the perfect herbal coffee. No acid, no caffeine, completely bladder friendly. Foley, you know, I was working with another patient who had a Foley. She'd had a Foley. So a Foley catheter is a catheter called an indwelling catheter that has a little balloon at the end. And so what happens is they put it in and then they have this little balloon that blows up so it can't come out. So basically you have a 24/7 catheter that just drains urine. I have to say my mother loved her Foley. Loved it. And she was in the hospital 3 times with pneumonia in the last 2 years. And the single most important thing they did for her was that Foley. And even in her last hospitalization, that first day, and they were, you know, she couldn't get up and use the commode. And I just reinforced to the doctor, please give her a Foley. And they're like, well, we don't really want to. We want to help her get up and use a commode. And I'm like, number one, she's 94 years old. Number two, she's had grand mal seizures and she couldn't sit on a toilet anyway. I tried. And we knew she was dying. Like, give her the freaking Foley. And they were like, okay, we'll do it. Oh my God, she was comfortable. And Melody says it feels better. Exactly. So Melody, the question is why? Why are you retaining so much urine? Well, either your pelvic floor muscles are really, really locked down tight, or your bladder wall has become dysfunctional in some way. So it is very, very important that you get to your urologist and you get that checked out. Odds are it's probably tight pelvic floor muscles, but they've got to do that workup. Foley, so a thing to understand about a Foley is that you know, urine has minerals in it, it has crystals in it. And so what happens over time with the Foley is that the minerals start to crystallize on the outside of the catheter. So the part that's in contact with urine gets these crystals on it. And so if you've had a Foley for an extended period of time, the odds are there's going to be a lot of crystals on it, which means removing it's going to be a beast. It's going to be very uncomfortable. And so ideally with a Foley, you get it changed periodically so that you don't get stuck in that situation where you're dealing with a lot of crystals. But girl, if it feels better, giving you a bit of a rest from getting up and going to the bathroom, giving your bladder a bit of a rest, so that if you have eaten something that's irritating, it's just going to pass right through and not sit in your bladder for a long period of time. So I think that they made a good decision giving you that folate. Now we got to figure out why you're retaining. Danielle says, to give you an idea of how unprofessional the last doctor I had is, that I only had for 2 months, he put some type of lidocaine cream into a urine specimen cup and told me to take a tiny bit and put it there, but didn't explain what it was going to do besides numb me for sexual activity that I was not interested in hearing about. Yeah, he doesn't sound, I mean, lidocaine cream on your skin down there is great for vulvodynia, for any type of vulvar irritation. Sounds like he just didn't take the time to explain it to you well. Eddie says, is oat milk an IC irritant? For anybody who's intolerant to oats, it would be. Oats are poison for me. I wouldn't touch oat milk. I've had terrible IBS from oats, and so I am not an oat girl. My milk of choice is coconut milk, and because I'm on the West Coast, I also have access to Mocha Mix, and Mocha Mix is fabulous. Oh, by the way, I found a new, very bladder-friendly cereal. Hold on, let me go get it. Alrighty then. So, with my IBS, I have always gotten very sick from cereal, like Cheerios, granola, anything at all like that. And I think it's a combination of the oat sensitivity, which is proven by a doctor, but also the preservatives. And so, if anytime I've tried to do cereal, usually it's been like a hot rice cereal. Even Rice Krispies used to bother me, and because I also think I have an issue with the BHA, BHT preservatives in cereals. All I know is if I eat a traditional cereal, I will be bloated, nauseous, and dizzy all day. And it's been that way for me since my 20s. Okay. But then I found this. Sprouted brown rice crisp, gluten-free cereal by 1 degree. And there's just 4 ingredients in it. There's organic sprouted whole grain brown rice, organic coconut sugar, unrefined salt, and vitamin E. I can eat it. I can eat it. I had it this morning with bananas and blueberries. So if you're sensitive like I am, look for this company, 1 Degree Organic Foods. And this is the gluten-free sprouted brown rice crisps. These are awesome. Like I want to totally make rice, the sticky rice crispy cookies that you make with this and marshmallow. Like I'd kind of like to make that because I haven't been able to have that in 30 years and I used to love it. So anyway, 1 Degree Organic Foods. I don't even know. I mean, I found them at our local organic food store that I shop at. Let's see. Let's see what they make. Okay, 1degreeorganics.com. All right. What are their products? We make clean foods that are nourishing versions of your family favorites. Our products are always organic, non-GMO, glyphosate free, yes, and never contain anything artificial. They use sprouted grains, legumes, and seeds. Oh, wow. Coconut hibiscus tea infused granola. Ooh, I don't know if I would like that. I don't do granolas because of the oatmeal. Sprouted quinoa hemp instant. Ah, darn it. Give me things without oats. Here we go. They have lots of oats. Oh, okay. Ooh, they've got sprouted brown rice, cacao crisps, sprouted oats, sprouted cacao oats, sprouted brown rice crisps. And they have breads and flours. Fascinating. Mary says, if you're well past the change, honey, you're looking good. Can a history of diagnosed endometriosis still be a problem, or is that very much over? Thank you very much. Well, because you're over the change and you just don't have a lot of estrogen in your body anymore, the endometriosis is not going to bleed, and it's that's the problem with endometriosis. I mean, there are two fundamental problems with endometriosis. Is that wherever that endometrial tissue migrates in your chest, when you used to have your period, it used to bleed, and blood in your belly hurts a lot. Blood is supposed to be in blood vessels. If there's blood free circulating in your belly, it causes terrible pain and cramping. And then the other thing that endometriosis causes is it's like scar tissue. It's thick, adhesive adhesions, and so it can constrict and bind and wrap around things. So for Mary, for you, it's not going to bleed anymore, but you could still have some adhesions. It could be wrapped around your bowel, wrapped around your bladder, that could potentially be causing some issues. So that doesn't necessarily go away until they cut it away. Danielle says, it's wild that you said what you said about crystals in the urine. I've been told many times I have crystals in my urine before and after wearing a Foley catheter for 9 straight months after they cut into my damn bladder. Yeah. Yeah, honey. I mean, I hope you got compensated for that. I mean, because that was a massive mistake for them to cut into your bladder during a C-section. Did you do the research and make sure there wasn't any action against that doctor for other surgical mistakes like that? Because that's a really bad mistake. Sometimes it's important to look at the history of the doctors that you're seeing, right? You can go to your state medical board. Every state has a medical board where these doctors have to pay for their license, and on that medical board, you can see if there are any history of warnings or actions. Oh, there's a fire. Wait, what? That's not good. It's not too windy, though. I don't think I have to worry about it. But, oh, there's a new fire that started 30 minutes ago. I don't see any smoke. The wind's going that way, and the fire is that direction. So the smoke's going that direction, so I wouldn't see it. Well, crap. Oh, it's always something. Mary says, diagnosed with endo without any surgery except a DNC in my 20s, diagnosed with lesions in IC in my very late 60s. Would then endometriosis possibly affect my life with IC in my 70s? It could. I mean, I mean, did they ever? I mean, the challenge here, Mary, is that they never looked in your pelvis. Did they ever do a laparotomy and just stick cameras in there to get an idea of where the endometrial tissue was? Because if you have endometrial tissue attached to your bladder, or worst case scenario, burrowing into your bladder wall or wrapping around your bladder, that would give you problems in your 70s, definitely. So if you're finding that you're having very, very persistent pain, especially locational pain, that's focused in one specific area, I would definitely be asking for a doctor to explore that a little bit further. For me, because I didn't believe my diagnosis of IC, I flat out told my doctors, I think I'm dying of cancer. I don't believe you. Only cancer could hurt as bad as I'm hurting right now. And so I said, I want you to open me up. No hesitation. I need you to look because I don't believe you. I think I'm dying. And my gynecologist, Dr. Bennett, was like, really? And I'm like, oh, hell yeah. I couldn't stop thinking about it. I just thought I was dying. This whole time. This is when I thought I was dying with this picture that I showed you at the beginning of the meeting. This is July 1993. You can see I have the electrodes in my ankles here, right? That was at UCSF. In September, I had my laparoscopy. And that is I don't even know how to describe that smile. I was so tired. I had been in so much pain that year. So much pain. I think I was just happy to be with a doctor who understood that I was in pain. And I will never have bangs again. Mark my words. Danielle said, well, during my C-section, it was routine and fine. They told me years later that my C-section cut into my bladder, but in the paperwork, they had to cut into my uterus. It was like they were trying to cover up all kinds of stuff, and they left network one by one until all three of my whole team was down. No compensation. They have so many things blanketing them. So I just suffer from that whole surgery that was supposed to be a routine prolapse, and they ended up cutting into my bladder at that point. Well, was it a... Did they send you home from the hospital when you had your baby with the catheter? Danielle said, luckily, when I had my son 30 years ago, I had a board certified OBGYN, and when I had a C-section, so that doctor thankfully did her job properly. I'm so sorry, honey. That's why in our AUA guidelines, for the first time, our American Urology Association guidelines for IC, they make it a point to tell patients that you need to check the history of any doctor who is suggesting that they will do surgery on you. That any type of surgery in your pelvis, in your bladder, needs to be done by somebody who's highly skilled, highly experienced, with a very, very good track record. And that was new for them. They did not do that in 2014 and 2011. And I think that's because you can see the track record of patients who unfortunately had surgery from lesser skilled doctors who ended up hurting them. I have a very good male friend who's decimated by a surgeon who's now in jail. He hurt tons of people. He was just botching his surgeries right and left, and he knew it. It's kind of like those people who pretend to be doctors when they're not. So I'm so sorry that happened to you, honey. I'm just so sorry. As I was driving home yesterday from my sister's house, and I got to spend the afternoon with my nephews and the grandkids, and I was driving home, alone. And I just had this moment of deep, profound grief that I don't have my own family, And I've had this, when I was a kid, it was like, you're going to have 5 kids and you're going to have a little redheaded girl. I had dreams about a little redheaded girl that I would have. And I'm still 40 years later, absolutely stunned that I don't have children. I had a miscarriage. I don't have children. And this, all I can say is that, I have faith. I believe in spirit. And I believe that there is a reason why, It's the only, I know that if I'd had those 5 children, would I have been healthy enough to have those children with all the medical stuff going on for me in my 20s? The answer is no. Could I find a gentleman who could have handled all my medical stuff going on, along with my very acute anxiety back then? The answer was, oh, that was damn hard. And I'm just kind of gobsmacked that all this time later, it's like, where's my family? But I have to have faith that this is the way it was always meant to be. That I agreed to this before I was even born. My spirit agreed to this, right? So you are my family, you are my family. Oh God, let's not talk about this. Oh, it's hard. It's hard. Tears come very easy these days. Okay, I have to go get a Kleenex. I'll be right back. The tears flow like clockwork. This is going to be my cry moment for the day, I guess. So hopefully, at least, we have helped some of you build your families. Oh, wait, now I messed up my mascara, didn't I? That look okay? All right, it is what it is. There's somebody I watch online who she lives in Ireland and she raises sheep, Zwart Bull sheep, Susanna, and I'm one of her Patreon followers. She's like 10 years older than me. She runs a farm. She's got like 6 or 7 dogs. She's got like 50 sheep. And she's made herself this wonderful family of friends and people online, and then all of her animals. And it's like, oh, I need my animals. I don't have any animals because I couldn't do animals because I had to care for my parents, right? Now people say, go get some animals. And it's like, oh, I want to get through fire season first. Maybe in November. I want to get through. I don't want to be responsible for any. Now listen, if a dog or cat shows up and they've been abandoned, I will take them. I would never turn an animal away, like I don't turn people away. Um, uh, so, God, or mom and dad, my dad was the cat whisperer. You know that if that happens, I will be there. I'm the person who stops and helps the dogs and cats hit by cars, for God's sake. Even on Christmas Eve, I did that. But I just feel like I shouldn't be responsible for any living being for another couple months. You know, I tired myself out caring for people for so long. I just have no I don't have any reserves for emotional reserves right now. I just don't. I mean, I cry like this every day right now. But I'd love to get a couple dogs and a couple cats. I would. Of course, now we've lost so many vets. That's the other thing that's happening is a lot of doctors have relocated or just quit the profession, and so it's getting harder and harder to find doctors, and it's getting really hard to find vets. So even if you get a dog, it's like you got to wait 2 months. No, 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 not 2 months. Somebody was telling me 3 weeks just to get their shots. So, oh, thank you for being my support. I am not perfect. Danielle says we have a new moon on Tuesday, and I know I get extremely emotional, more so than normal with the new moon, but you're such a blessing. Yeah, Danielle, I lost my parents 2 months ago and I was caring for them. So that's normally I'm pretty strong. Yeah, Donna says self-care. Yes, I'm gonna be going out with a friend after I'm done here. We're gonna go to a local golf club that has a nice restaurant, and we're gonna go sit and drink not alcohol and eat and have a nice meal. Loretta says, I'm so sorry. We are your family. We love you. Thank you, honey. Oh, is there any way you can help me? Just prayers, emails, stuff like that. Oh, life. I didn't think this would happen on air, I just didn't think it would happen on air like this. Sorry about that, but oh, who knew I was a crier? I'm a crier. Okay. Any questions? Any more IC questions out there? Distract me, please, from having my pity party here. Mary says, definitely get rescue pets, paying per. Yeah, no. All my pets have always been rescues. I had a neighbor who had a Great Dane. I love that dog. Oh my God, it was a female Great Dane. She was the sweetest, nicest, happiest dog I've ever seen in my life. I've always wanted a Great Dane. Oh no, it wasn't a Great Dane. It was a Doberman Pinscher. No, and even though Dobermans are kind of scary dogs, oh my God, that dog was so wonderful. I just loved her, love her. And then I have another neighbor who has a standard poodle that is just to die for. I love that dog. That dog is, whenever I see him, he comes all over and we love on each other. I just love that poodle too. I just can't get a really heavy dog because I can't lift them so much anymore. Danielle says, never ever be sorry for crying. Oh, thank you, honey. I love cats. I love cats too. I mean, I love all animals, so we'll see. Okay. I'll be okay, guys. I promise. This is a good, healthy expression of grief. Lisa says, see my granddog to the left? She brings me so much happiness. Did you put a picture in there? Yeah, right now, none of our family have pets. No, I take that back. My sister has a cat, and the cat did sit in my lap last night. Danielle says, I think I shared I'm a medium with you once for some reason. I do see a calico cat coming into your life. As you know, most of them are female, and if you get a male, it's very rare. But I hope that this, honey, my last cat was calico. And she was fantastic. She was 20 years she slept on my bed. Let me see if I have a picture of her. I have tons of pictures of her. What am I saying? She was half calico, half cloud Siamese, I think. Let's see. I love that sweetie pie so much. That's my Sammy. Oh, I have to lower it for Facebook. You guys see her on Facebook? 20 years. 20 years. Best cat ever. Can't wait to see her again. Oh, Lisa says, I don't know how. She's my Facebook picture. Oh, okay. Well, thank you, Danielle. Thank you. I'm open. I'm open to the possibilities. No doubt about that. All right, guys. Well, listen, any other questions? Any other questions on IC? Loretta says, my cats have been by my side during my worst time. So much comfort. Yeah, Sammy was the best cat ever. I lost her in 2017, right the year of the big fires and right before I had my uterine cancer. There's always a plan. There was a plan there. It worked out just fine. But she's with me all the time. All right, last call for questions. Last call for questions. If not, I'm sorry. I'm gonna go sit in the sun. Danielle says her soul is going to come back through another cat. Okay, that makes perfect sense. You will feel it right away that your cat is returned. I hope so, because she was my mom. You know, that cat acted like a mother to me. It was hysterical because if I was doing something that scared her, like we once had a fire right here on these hills, and I was standing out in the court. I live on a court, and the fire bombers were flying really low over our heads and then dropping fire retardant. And it's always very exciting to watch the planes, and they were really low. And she was on my front doorstep, and she was calling me like a kitten. She was calling me like a kitten. And I kept yelling, it's okay, Sammy, it's okay. And then she walked out to the end of the driveway, and it was this urgent mama cat call. It was like, rawr, rawr, you know? And it's like, it's okay. It's okay, honey. It's okay. I was 3 houses away. And she kept calling, walking slowly down to where I was. And I saw how upset she was. And I just immediately came, and she just ran into the house and she just chewed me out. Don't you know that was dangerous? It was hysterical. Andrea says, I'm getting Botox and my pelvic floor. Any advice for before and after? I think you have to have a reality check on what you want it to accomplish. And make sure that you talk with the doctor about how they're going to do it. So I would assume that they're going to do it as injections through your vagina. How are they going to do it? Do you know? Are they going to do injections through your perineum, or are they going to do injections through your vaginal wall? It's a good way to use Botox, because if you've got a muscle that's in sharp spasm for one reason or another, that will definitely calm that nerve that's driving that spasm. And it might last for a couple of months, and that's really viable. The advantage to doing Botox into your pelvic floor as compared to into your bladder wall. It should not come with a risk of not being able to urinate afterwards. Just understand, I was working with a patient who had Botox injections, and I don't remember if it was in her pelvic floor or in her bladder, but they accidentally injected it into a blood vessel, and it almost stopped her heart. So, like 30 minutes afterwards, I think, as she was walking out of the hospital or the doctor's office, she started feeling dizzy, and it's a very, very rare. I mean, only once have I ever talked with anybody that anything like that has happened to. So she ended up doing a week or two in the hospital as they waited for that Botox to wear off. So I think it's perfectly reasonable to ask that doctor who's doing it what kind of complications they've observed, and what are the symptoms you need to look for and pay attention to in the hour or two after you have it done. It was very obvious in her case that it had gotten into her blood. I mean, it was like you just scored a direct hit right into a big blood vessel. So ask your doctor about known complications, what you should be aware of: dizziness, lightheadedness, pain, anything at all like that. Because there's always a risk with any procedure. And Botox acts by calming nerves down. And if you get the Botox in the wrong place, it can calm the wrong nerve down. Danielle said, I would definitely like to tell you more sometime, but trust me, everything comes full circle. Continue to embrace your beautiful self. Thank you, honey. I feel that. I really feel that. I have tremendous faith in spirit. I do. I do. And I feel everybody very close to me anyway. I do. You're very welcome, Andrea. All right, guys. Well, listen, sorry to be a little emo today, but you know what? It is what it is, and I can't turn it off. This is me. This is the real Jill Osborne. What am I doing this week? Let's see. What am I doing this week? Getting the final proofs done of our magazine. What else? New skinning. We're going to be re-skinning a bunch of stuff, rewriting a lot of stuff. And again, my IC masterclass, which everything stopped. Got to do that. I just haven't had enough time to do that yet. I've been catching up with all this stuff that I couldn't get done in the last 3 to 4 months. And of course, if you find this helpful, please come on over to the IC Network and think about becoming a member. If you become a member, then you get our wonderful magazine, the IC Optimist, and that's what makes these meetings happen. You know, that's how I pay the bills, is with memberships, and buying products like Pre-Leaf in the back, which is our top supplement by far, one of our top supplements. Danielle says, "Are you an empath? Because I do feel that in you." Oh, honey, yeah. We should talk. We should talk. I have an aunt who very similar to you, and everybody calls me Auntie Mister. I'm the Auntie Mister of my generation. There's no doubt about that. Lots of empathy going on there. Got to have good protection doing this work. So, but anyway, I love it. So, all right, guys. Well, listen, be well. Have a great rest of the day. Andrea says, I'm a new member, newly diagnosed. Well, Andrea, is there anything that we can help you with right now? I mean, are you struggling with anything right now? Because you're exactly why I do these meetings. I don't have to leave right away. I normally leave when things calm down. Okay, are we done? Andrea, just know that if you ever have any questions, you can call us direct, 800-928-7496. All right, guys, I will see you later. Have a good one. And thank you all for your very, very good vibes. Life, challenging, isn't it? Yikes. All right, Facebook is done. All right, you guys on YouTube, I'll see you later. Bye, Donna. Bye, everybody. Bye, Eddie. And whoever else is in the YouTube chat.